Gonococcal arthritis is an infectious, in other words, septic, form of arthritis which occurs in those who are infected with the bacteria Neisseria gonorrhea, which is a gram-negative diplococcus. So there are two forms found of this disease. One which is associated with a skin rash and typically has multiple joint involvement, and a second form which is associated with disseminated gonococcemia, and this leads to an infection of one joint. In one study from Durban, South Africa, monoarthritis, the gonococcemia and one joint infection, was the most common presentation, occurring in 78% of patients. The joints most frequently involved were the wrists in 44%, knee in 41%, ankle in 15%, and shoulder in 12%. Now, although the most common presentation of gonococcal arthritis is this septic monoarthritis with disseminated gonococcemia and a single joint involvement, there is a second syndrome that does exist that I want you to be aware about. And this is called the arthritis dermatitis syndrome. It's essentially patients who get a skin rash, which is typically numerous papules, vesicles, or pustules, and an erythematous base, and is associated with either a migratory or an additive polyarthritis that is asymmetric. So, in other words, patients will say, 5 weeks ago, or maybe 3 weeks ago, I had swelling of the wrist, and then that resolved, and I got swelling of the knee, or maybe the wrist persisted and I got swelling of the knee on the opposite side. And this was associated with a skin rash. Although only up to 40% of patients actually report a skin rash can be identified in most patients upon a close physical exam. Now, since gonococcal arthritis is the most common cause of septic arthritis in young adults, it's really important to have a high index of suspicion for this disease when you're seeing a young sexually active person presenting with acute knee swelling and pain and inability to walk on it. Now, although Neisseria gonorrhea can be identified on culture of the synovial fluid, it is really important to look for other places to culture the gonorrhea from, most specifically either a urethral or cervical swab. So in all patients who are young and sexually active and whom you suspect of may have gonococcal arthritis, it's important to also do a genital exam and to send a swab from the urethra or the cervix for culture or, if available, PCR. Patients with gonococcal arthritis usually require initial hospitalization for IV antibiotics. Upon improvement, however, they can be switched to oral antibiotics. The total treatment duration should be at least 7 days and should include IV ceftriaxone or cefotaxime, which is given at 1 gram daily until symptoms start to improve, but for a total of 7 days, plus an initial 1 gram of azithromycin should be given in according with CDC and also your World Health Organization recommendations for the treatment of gonorrhea. The azithromycin is given in order to treat possible concomitant chlamydia infection, which is quite commonly seen in addition to gonorrhea in patients with STIs.